Hey everyone, we've got another heart today. This is number 264 in our collection, and we'll start off with our quick teaser, which is pretty clearly evident that what we're going to be seeing today is a specimen with an outlet ventricular septal defect. So now let's go ahead and just situate ourselves. The anterior wall of the right ventricle has been removed, but anterior would be coming towards the screen, posterior towards the turntable, inferior legs here, superior or head here, left over here, right over here. Now let's start off as we usually do, which is by trying to identify, at least externally, what appears to be the right atrial appendage. And here we find an atrial appendage that's triangular, pyramidal, or broad-based, consistent with externally a morphologic right atrial appendage. So let's go ahead and open up the heart there. And when we do find that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. Here we find the oval fossa, and there does appear to be a defect in the oval fossa. And you can see the flap valve very nicely here. Here we find the mouth of the coronary sinus, and here is the Thebesian valve guarding it. And then here is the tendon of Totaro. And we do know that the tendon of Totaro, the mouth of the coronary sinus, and the right-sided atrioventricular junction form a triangle called the triangle of Koch, and at its apex is where we expect the atrioventricular node to live. So we'd expect the AV node in this heart to be right here. Also, let's take a quick peek at the superior caval vein, which is draining into the heart right up here. Oops, sorry. So here is the superior caval vein draining into the superior aspect of the right atrium. So now let's go to the right-sided atrioventricular junction. This is guarded by an atrioventricular valve that does have a round or oval annulus. It has 3 leaflets, 1, 2, 3. There are direct connections to the ventricular septum, consistent with a morphologic tricuspid valve. The ventricle that it opens up into has coarse trabeculations and does have a septomarginal trabeculation, aka a moderator band, consistent with a morphologic right ventricle. Now, when we're looking at this, it's very obvious that there in fact is a ventricular septal defect. This ventricular septal defect lives within the cranial and the caudal limbs of the septomarginal trabeculation, aka the Y of the septal band, meaning that this is an outlet ventricular septal defect. Now, when we look at the postero-inferior border or rim of this ventricular septal defect, we see that it is in fact fibrous. Here is the tricuspid valve right here. Now, in some hearts with an outlet ventricular septal defect, there will be a muscular postero-inferior rim, and this is an important finding to note for the surgeons, as it can have some implications as to where they can or cannot place some of their sutures when they try to patch close this. When we come to the first arterial valve here, it appears to have 3 leaflets, 1, 2, 3, with 3 sinuses, 1, 2, and 3. No coronaries are arising from them. Completely supported by muscle, consistent with a pulmonary valve. It's harder to notice here, but the arterial valves do not actually have a round or oval-shaped annulus. They have this crown-shaped annulus, as the half-circle fibrous valvar leaflets have these myocardial triangles that interpose in between them. That's not to say that the circular or oval-shaped annulus we create clinically isn't helpful in decision-making, but that isn't a true anatomic finding. Here is the pulmonary trunk. Here is one of the branch pulmonary arteries. So now let's go to the posterior aspect of this heart. And let's go ahead and look at the other atrium. And when we open up this other atrium, we find an atrium that's smooth-walled, consistent with the morphologic left atrium. Here are the horns of the oval fossa. Here's the backside of the oval fossa itself. This is the orifice of the left atrial appendage, and here is the left atrial appendage. And you'll notice that all the pectinate muscles are confined to within the left atrial appendage itself, consistent with the morphologic left atrium. If we turn our attention to the left-sided atrioventricular junction, we find that it is guarded by a valve that has an oval or round-shaped annulus. This valve has 2 leaflets, 1, 2, and this valve does not have any direct connection to the ventricular septum, consistent with the morphologic mitral valve. And so this is the anterior leaflet, and this is the posterior leaflet of the mitral valve. Now, when we go ahead and look at this ventricle here, we do find that this has fine crisscross trabeculations consistent with a morphologic left ventricle. And then here is the ventricular septal defect, which we had seen from the left side before, from the right side before, and know that this is an outlet ventricular septal defect. Here we come across another arterial valve, which appears to have 3 leaflets, 1, 2, 3, with 3 sinuses, 1, 2, 3. Here's a coronary artery arising from within one of the sinuses, all consistent with a morphologic aortic valve. And we do see that there is, as expected, fibrous continuity between the aortic and the mitral valves, which makes it a little different from the pulmonary valve, which is completely supported by muscle. Here's the ascending aorta, and then here's the transverse arch, and then the descending aorta here. So a heart with an outlet ventricular septal defect with a fibrous postero-inferior rim.